Welcome to Physicians Keepers. Each episode features honest conversations with physicians, sharing moments that shaped them, challenged them, or taught them something worth passing on. These stories come from every corner of a physician's life: the clinic, OR, family, finances, mental health, leadership, and personal growth. If a story can help another doctor feel seen or strengthened, it belongs here. It's about honesty, courage, and community true storytelling. If you are looking for connection or a reminder that you are not alone in navigating this profession, you are in the right place. Hello and welcome to another episode of Physicians Keepers. I'm so excited to have you here today. If you're watching on YouTube or you're listening on Spotify, thank you for joining us today for another session of just sharing stories and diving deep into another physician's journey. And today I have with me Dr. Hannah Parr, and I appreciate her for taking this time out of her busy schedule to come share her journey and her story with us. Thank you so much, Dr. Parr.
No problem. I'm excited to be here.
And so I'm just going to talk about Dr. Parr. I'm going to give a brief bio and we're going to dive straight into her story because it's definitely something that you would want to hear. So Dr. Hannah Parr, DO, is a physician and diabetes educator, and she is passionate about helping people take control of their health. She shares evidence-based strategies for managing chronic conditions like type 1 diabetes and building sustainable healthy lifestyles. But she has a journey that she took before she got to where she is right now. And we are going to go into her story. So, Dr. Parr, based on the information that you shared, I think when you sent me your bio, you deal with type 1 diabetes, am I right?
Yes. Mhm.
Okay. So so you're a physician and you deal with type 1 diabetes. How has that helped, that dual perspective? How did that help shape your journey as a physician and also in medicine?
I love this question because so
Yeah.
much of my why of being a physician comes from my diagnosis of type 1
Yeah.
diabetes. And I was diagnosed at age 13, so I was a teenager. And I just had a lot of questions about health. It was obviously a very kind of traumatic diagnosis as a teenager, learning
Yeah.
that there's something that makes you different and you'll have it
Yeah.
for the rest of your life. And at that age, not even really being able to understand all of what it meant,
Yeah.
having to take care of myself differently. And for those of you that don't know, type 1 diabetes is an insulin deficiency. So you're constantly taking injections or taking insulin through an insulin pump 24/7 and watching your blood sugar levels as your medication needs change. And
Yeah.
so it's very hands-on diagnosis. And so for me, I had just so many questions growing up. I was living a kind of a regular American teenager life. I was on the dance team and had friends. We'd go to Sonic after the football
Yeah.
games, all kinds of things. And I would have more high and low blood sugars than I wanted to have. And so I would have questions at my doctor's office, how do I feel better? What types of foods can I eat? How do I sleep better if I'm waking up in the middle of the night with low blood sugars often? And those questions, there were good answers for, but I was left with a lot of optimization questions. I could figure out how to keep myself safe and out of the hospital, but I couldn't figure out how to feel great in my body. And
Yeah.
so I ended up studying nutrition in college, just feeling like there were more
Yeah.
answers there. And we learned about how to read medical literature. So, like, open the world of PubMed. And I thought, oh my gosh, so many of the answers I've had are actually here in studies. And I started applying them to my life and felt so much better. And that started my journey to want to go into medicine. And so I went to William Carey, which is a medical school in a DO school in
Yeah.
South Mississippi, and learned a lot about communities that had not yet learned how to take care of their bodies. I mean, chronic
Yeah.
illness is so common. And it really is a lot of the health habits, people just don't know are hurting them until they find
Yeah.
out, when they're 40, 50, 60, and they get their first chronic disease diagnosis. So that kind of pushed me into medicine, was just the idea of learning that there are things that we can do after just treating the disease that can actually improve our quality of life and decrease our risk of chronic disease in the future. And so that's kind of my why and how it all played out.
Oh, wow. So, based on what you shared, there were gaps, even though you were getting, kind of the basics with your diagnosis and just, but there were gaps in your care. Well, and more in the information from you, from a doctor's standpoint, to say, okay, this is what you need to do in between. And so you felt like you needed to step into that role um, to help others with that. So that's a really inspiring journey. So now with you, with all the information you got, nutrition school, medical school, did you feel like you were confident enough to like, okay, not just help yourself, but then help others?
Great question. Yeah. So I don't know about you, but for me, confidence in medicine came slowly, right? Year after year, it's kind of like you start something, you're not sure, you've never done it before. Am I capable of this? And kind of you move forward. And so I got through medical training and was in my first year of family medicine residency. And we were, seeing primary care physicians and a lot of hospital care work. And I saw so many patients, the more patients we see, I saw this pattern of people learning that they have a disease and then getting the medical tools, which are so important, right? The surgery or the
Yeah,
medication prescription to help optimize their disease risk, but lacking the information about how to take care of their bodies. How much sleep do they need? What forms of stress management work? How much movement do they really need? And how can they incorporate that if they have a job where they sit down all day? And what types of foods actually make a difference? It was almost like we're treating the disease without teaching each other how to take
yeah,
care of our bodies in the first place.
yeah,
And I remember one of my patients, he in the hospital had a heart attack, and I think he was post-cath or post-cabin, I can't remember. And I was talking to him about changes he could make when he goes home before discharge. And we have like a little printout at the hospital, and then they bring in the lunch of the day at the
yeah,
hospital, which was like fried chicken and diet soda. And
yes,
I just remember like, oh, I wish, like I was in a hard time. I think residency is challenging, but just really thinking about what direction I wanted to take my career. And I just thought, I want to be the doctor that met this patient 20 years ago
yeah,
and taught him how to take care of himself so he's not here today.
yeah,
And then I looked into my future of, family practice, primary care, which is amazing. And I saw myself seeing, 30, 20, 30, 40 patients
yes,
a day really quickly and not having time to teach them in the ways that I really felt were in the people who are looking for that information in
yeah.
their best interest. So I left residency after my first year. I got my Texas medical license. And then I went on to do training and full certification through the Institute of Functional Medicine, which
Mm.
at the time was the only place I could really find nutrition lifestyle training
Yeah,
for physicians.
yeah,
And then I also went on to become a diabetes educator. And now I work in a direct primary care practice. And the confidence came very slowly with each step, kind of learning and practicing and saying, like, okay, I can do this.
yeah.
I'm seeing changes in my patients. And I still feel like, the confidence, it's slowly still comes, as you see more wins and you learn more, really. But
Oh wow. So that was I mean, that's a major step. That was a bold step you took, like leaving residency, right? So how, I mean, just everything around you at that time, like friends, family, when you told them the news, how did that go with them? Because remember when you're most people when of course when you're into med school, you're in the training, there are a lot of people that are like, yeah, like kind of pushing you on, right? So
yeah.
how was that for you when you shared that news that okay, I think I want to do something different, not the traditional course that most doctors do. Was that something that they kind of welcomed and accepted, or were there some struggles with that?
No one's ever asked me this question before. So I had a very supportive family friend community. I got into my first choice for residency. I was doing well in all my exams. I was
Yeah,
very kind of well standing, but I just knew that I came to medicine to be a change. I didn't want to just continue the system as it is. I wanted to be a part of the change that I saw
yeah,
the need for growing up.
yeah,
And so a lot of, my community kind of knew my story there. And so I I think when I broke the news to my family, to my friends, no one thought it was a good idea. I mean, everyone thought, you'll have more job security if you continue residency. And it was a lot of hospital training. I knew I was closing the door on practicing in a hospital in the future. But I really didn't want to be there. And
Yeah.
I think part of it for me was saying I need to do something differently. I can see
Yeah.
myself just kind of getting sucked into a regular hospital-based clinic and not being that change that I promised myself I came here for.
Yeah.
And so it was hard. I met resistance kind of from everyone. And my residency team they were actually very accepting and, asked if there was any support I needed. I had already lined up a job prior to kind of notifying them that I was
Yeah.
leaving. And then I stayed on until they found a resident to take my place. So I stayed on for 4 or 5 months after. I think my co-residents were a little bit confused. They didn't really fully understand, or at least that's how I felt. But my residency director was kind, and they were like, well, you could do research, or they were kind of trying to help me figure things out.
Yeah.
And they even said, we'll hold your spot if you want to come back next year if you changed your mind. Everyone just kind of didn't see it working out. But what's
Yeah.
so interesting is since then I've met many other physicians that have done this.
Oh,
Kind of left after getting their medical license before finishing their certification or their board
yeah.
certification in a certain specialty and done more lifestyle preventative medicine. And I think there's a place for that. There's just not a clear path right now, if that makes
Yeah.
sense.
Yeah. Yeah. Well, you are very brave. I must say that because
Yeah, I've heard that one.
were there any fears that you had personally, like making that decision? Like, were there any, thoughts in your head or like voices in your head that you had to like say, okay, I hear you, but I hear here. Like I know what I want. And I feel like if I don't do this and I just go the route everyone's going, I would not be satisfied. Like what were the fears that you had to like just calm down to make you take the decision that you did?
Yeah, so many. I think the biggest fear is anytime you do something different than the rest of the group, you wonder if the plan that you have will work out, and so that was there, am I creating any concerns for my future career where I won't be employable or I won't be able to help people? So that was one, and I think it was meeting many other physicians who had kind of taken that path that helped. I somehow got in contact with a physician that was teaching at a school up in Maine. He was part of faculty. He had left
Yeah.
after his first year of residency and was doing well. And his mentor was Dr. Andrew Weil, who created the integrative medicine training in Arizona. That's now
Yeah.
it's actually now, I believe, a fellowship. So it's
Oh,
gotten kind of full accreditation. And he also left after his first year trying to be the change. And so there are many other stories. And it was just, I think it was kind of these stories of people who had this dream and made it work in a different way that really helped me calm some of that. And still, I mean, to this day, I can't say that it was the right choice, but I can say I feel like I'm in a good, or it was the best choice, right? I mean, in life, we can always take multiple paths and it's hard to know which one is best. But I believe I'm in a good place where I'm helping patients. We're losing weight, getting off blood pressure medications because we no longer need them, figuring out how to eat for our body. There are a lot of things that I think people are looking for answers and can't find them. So I'm happy to be a place for that. But I think, yeah, I don't know for sure if it was the right thing, but I'm glad I did what I did. And I think that hopefully in the future, we find more paths for people who want to do more prevention clinically.
that is awesome. And one of the things that you mentioned, which is so important, is that you are taking this journey, but that you there was someone else who you saw who had taken it. There was a picture of a representation for you as like, okay, he did this, and I think if I want to do this, I have some help or I have some backing. So it's always so helpful, like to whatever, course or path you're taking when you can see someone who has the same mindset as you have and who wants to create change. And that kind of gives you the reinforcement that, okay, I'm on the right path. And like I said, I'm glad you did. I mean, I'm primary care, so I know pretty much what it is in terms of, the visits, and I also did, I'm board certified in lifestyle medicine, so you have
Amazing.
all,
Yeah.
you have all this knowledge and because lifestyle medicine is such an amazing field, but then how much of it can you really give in a typical visit? Right.
Right.
There's a lot of limitation. It's like by the time we finish talking about the diabetes and the blood pressure and the meds and the changes, there's so much time before we can delve into what your nutrition looks like, what it's supposed to look like, the exercise, the barrier, like the lifestyle changes that need to take place. So I'm glad that, like I said, that, there are people like you who can fill that gap and fill that void for patients because otherwise, like I said, it's just most of the time you're left with putting a band-aid, you know, over the illness, but you haven't gotten to the root of it when it comes to lifestyle decision making. So thank you for being brave enough to take the leap that you did. Now, and just kind of ask following up, was there ever any term in your mind where you had to, or time you had to unlearn what it meant to be a successful physician? Because for
Mhm.
most physicians, they would define it as, oh, I completed the whole training that I needed to do, and that makes me successful. But then you decided, okay, I think I know what I need to do, and I need to learn more. So did you ever have to unlearn that or remove that bias in your mind about, I'm successful, and this not having stopping my journey where I did doesn't make me less of a success.
Yeah, yeah, absolutely. I've really had to work on that. And it's funny because I'll work on it, it'll kind of, pass, and then some other, job opportunity will come up and then I'll have to work through it again. And so it's come and gone. But absolutely. I had this big turning point when I was in residency. I remember we had this one attending who was maybe a little bit more aggressive or harsh with their feedback. And I was just so nervous going into the hospital every day to work on this particular rotation. And I had a great kind of classmate who told me, what's really important to focus on is focus on the patient getting good outcomes, the patient thinking that you're kind. And those are the most important things. It's not whether or not the attending likes you. It's about the patient. It's not
Yeah,
about the attending's opinion of you. And,
yeah,
and so when I shifted my priority of focus from, what that attending thought or how they treated me and then trying to interpret their opinions of me just to my patient getting good outcomes and
yeah.
thinking I'm kind and caring towards them, then my whole relationship with practicing during that rotation got
Change.
easier. It felt right, because I stopped caring so much about what other successful clinicians thought about me, and I cared more about doing the right thing for my patient. And I think I took that, with each step in my career, whether it was leaving residency or taking a different clinic job, is that what really matters is that I'm showing up for that 13-year-old girl that got diagnosed with type 1 diabetes with a lot of questions and feeling really overwhelmed and not knowing how to handle her health. And if I can show up well for her, then I feel like I'm successful. But that took so many onion layers of peeling back, right? Is that what do I really think is successful? Because I used to think it was, getting the best grades you can get and, trying to be as perfect as possible and doing everything full out, even if that means you're exhausted and your
Yeah.
own health is slipping, and all these pieces. And so I really just had to kind of reframe and ask what was true for myself. And frankly, I still do as things change. But for the most part, that's where I come back to is that reminder, am I
Oh,
doing right by the patient?
that's such an amazing story, like you shared, because, you know, a lot of times they say we tend to measure um, patient success by either the volume of patients you see, and sometimes as a physician, how busy you are,
Yeah.
how stressed you are. Um, but in the end, it boils down to patient outcomes, right? If you know, if you're seeing 10 patients and maybe 9 out of 10 have been able to implement every decision you've made and take care of themselves better, versus you're seeing 40 and then you have a whole panel of unhealthy patients who do not know how to take the driver's seat when it comes to their health and all the time just rely on, take this medication and just, go figure the rest out. And then like I said, focusing it back on the patient. I mean, that's the best a patient could ask for, right? When your doctor is committed to their success. So I'm glad that you're such a valuable team when it comes to valuable person when it comes to helping patients. Now, you transition right now. You're for those who don't know what DPC is, because that's where you said you work. What's DPC about?
So DPC stands for direct primary care, and it's essentially a clinic model that is different than a traditional clinic that takes insurance that's maybe associated with the hospital system. And it's typically, sometimes it's individual physicians. The one that I work for is a group of physicians and nurse practitioners. And the way that we work is we have a membership that our patients pay monthly, almost like a gym membership,
Yeah.
and they have unlimited access to appointments, so they can have as many appointments as they want during the month. And then they also have discounted labs if they don't want to use their insurance for labs. And it creates a space where we see many less, much less patients per day. But we are able to, it kind of shifts the incentive that the healthier my patients are, the less they come back to the practice, the more patients I can have on
Yeah.
our, for our practice. And so the incentive is that my patients are as healthy as possible, that when they come into the appointments, they get all of their questions answered, in that appointment time, so that they have the tools that they need to go on. And if they have questions, they can message us or come back, but it kind of shifts the system. And it works really well for people who have high deductible plans where they're not getting their primary care appointment copays covered, or their labs covered prior to that deductible, because then they pay the membership fee at our practice, and often it's cheaper than meeting their deductible if they're going to their routine care. So we have a lot of patients that have maybe one, two, or even many chronic diseases where they would be seeing, they would be meeting that deductible, but they're able to see us and it's more cost effective. And then they get much longer appointments if they need them.
That sounds like an awesome model, separate from traditional, practice. And it sounds like that's for what you want to do in terms of, patient education. This just seems like the best model for you because then you do have that time to answer all those questions that patients come with that, in a traditional setting, when they're asking you, like, yeah, I really want to talk to you about this, but it's probably going to take 20 minutes of the whole visit. And pretty much at this time, we've exhausted like 10 to 15 minutes
Yep.
of this visit. So for those of you listening, that's pretty much what DPC affords, physicians to do. So you are very big on patient education on lifestyle. Why is that such a powerful tool, especially in chronic conditions like diabetes?
Great question again. I think so much of our chronic conditions, and you know this very well, and so many of the chronic conditions that you see, high blood pressure, high cholesterol, high blood sugar, these are often caused by lifestyle. And a lot of people can think of, their family, and there certainly are genetic components to these conditions, but we have so much control about our outcome of that disease happening to us, or the severity of it, based on how we choose to set up our life. What are our habits at home? Those can really make or break how our long-term health plays out for us. And I think that we live in a culture where we're not learning how to take care of our health in a way that works for us. And we've had so many changes since, our grandparents were young adults, just with more sedentary jobs. Our food system has changed quite a bit, where there's now ultra processed foods that are more addictive. We've got social media and all these things have changed, and it's no longer intuitive for us to set up a lifestyle that works for our body. And I
Yeah.
think many people are going through life thinking that they're, taking good care of their body. Maybe they're getting 6 hours of sleep. They're drinking 6 diet sodas a day. You probably understand kind of what we see. It's like
Yeah.
Chick-fil-A for dinner 3 nights a week. We see that, and they think it's okay and it's not going to hurt them. And they just haven't learned that they're setting themselves up, with enough of these patterns that are statistically increasing the risk of disease, that they're really setting themselves up for risk in the future. And so I think that's where it comes from, is that we just by default, the average American doesn't actually know how to take care of their body, in my opinion. And it's
Yeah.
almost, I love this analogy. It's kind of silly, but it's like if someone gave you a car, but they didn't tell you you have to refill, the fuel tank, or that you have to do the windshield wiper fluid, or that the oil needs to be changed, and you just drove it until it broke down. And then all of a sudden you're like, oh, how do I take care of this thing? That's kind of how we do our bodies, is
Yeah.
like we don't really learn about health until there's a problem. And so that's kind of where it comes from. I hope that answered your question.
It did, it did. And so thank you so much. Now, with patients getting this comprehensive education from you, for those who deal with chronic disease, especially diabetes, which is something, like I said, that you've had to live through, what has been their feedback? Because I can imagine that it's been finally having those sit down conversations with someone who has a wealth of knowledge, to kind of break things down within the right amount of time and not feeling rushed.
Right.
What has been the response with the patients that you see?
Yeah, it's a great question. I think people often come to our appointments with a list of questions. You probably see this in your practice too. And I was that patient for sure. So we can kind of get through the things that are on their mind as far as questions. And I find if a patient comes with a question, they're far more likely to implement it effortlessly because they're motivated,
Yeah,
behind understanding it. They came in with the motivation. But often, what I find is that when people are looking at their health, they maybe don't see kind of the holes in their setup.
yeah,
So maybe someone's eating a very healthy diet and they want to know how to make their diet even more healthy, but they're sleeping 5 hours a night. Oh, maybe we need to focus on the sleep. Maybe that would have more bang for your buck. And so
yeah,
it's kind of having conversations explaining those things, as far as health outcomes. And then often, it really is individual. One of the things I ask all of my patients when we're giving recommendations is, how's your life right now? What's your bandwidth? You know what I mean? If you have a family member in the hospital and you've got two kids at home and you're
yeah,
not, you're tired, we're not going to give you 10 things to do. That's not going to work. And so it's really getting to know what the patient is looking for and what their bandwidth is. And then the part that I have learned through practice is that if you don't address the emotional kind of piece behind
yeah,
the wanting to take care of themselves, it's really hard. If we eat a healthy diet from like punishment of feeling guilty because we have diabetes, we're never really going to end up stress free if we're always, feeling
yeah,
guilty and hyper focusing on our food. So we really have to figure out, why are we feeling guilty, kind of process through the ideas and of having guilt around a disease, really looking at doing the changes from a place of self-love. And when patients get there, then it's just them picking their own pace of implementation. And that feedback I get is that they finally feel like they're not alone with the disease, and that they're not at a place where they're being hard on themselves about it. And that's usually, what makes the patients who have good results, move
yeah.
forward.
Well, thank you so much for sharing that. Because one of the things that I encounter with a lot of people, especially those who've lived healthy for most of their lives, and they get a certain chronic illness diagnosis, when you're telling them, well, chances are you're going to have to deal with this forever, like the rest of your life. For them, it's overwhelming. And sometimes there's this mental block where they cannot, because in they can't see in their minds, they've created this, I'm a healthy person, nothing can touch me. And then when you start to say, well, yes, something did happen, your body's changed, it's not the same, this has happened, they it's hard for them to get past that mental block to say, now I have a chronic illness that's going to require not just medications for a month, but medications maybe for a lifetime. And so they keep asking questions. When am I going to be able to get off this? When am I going to be like, is there a time that I think, can I just do this for a year and be done with it? But then, you know, it takes a lot of education and patience to get them to realize that this is something you're going to have to deal with lifelong. You can't live life the way you lived 10 years ago or 5 years ago, or even the day before your diagnosis, right? Something different has to change. So I'm sure, like I said, just the education that your patients will get from you in that sense will be so valuable. Now, are there patients that are, especially with a diagnosis of type 1, have you, which, I mean, you residency would have been one of those things, especially in the hospital, right? Where you see type 1 diabetics who keep coming back, especially the young ones who keep coming back to the hospital because they struggle a lot with the diagnosis, the management, not feeling like they can't live the same way that their friends are living, right? So it's like everyone's going to Sonic, and I know that I can't go have the same meals that they're having. I can't be careless. I can't go drink, right? I can't do all these things. How do you deal with such patients, the difficult ones who struggle with compliance? How do you deal with those?
I think what you alluded to in your question is that acceptance of a diagnosis. And I'm lucky. I have many friends and many, peers with type 1 diabetes, just that I've learned kind of or met through my journey. And it really it gets to a place where if we have a chronic disease that requires something like type 1 diabetes, constant management, but we haven't accepted that we have it and really made peace with the fact that it's a part of our life, then the actions, there's a lot of mental resistance towards taking, right? It's going to that, friend's house to hang out with other friends and not wanting to take your insulin in front of them because we can't accept the fact that we have diabetes. So we assume that they can't accept the fact that they have diabetes. And so then we don't take it. And then, fast forward DKA, we're in the
Yeah.
hospital again, you understand the process. And so it really is, I think the diagnosis of type 1 diabetes comes with diabetes education, which really talks about insulin management, counting carbohydrates, other things that can impact insulin needs. But we often don't have space in the medical system for helping people make peace with that diagnosis. And what I found is that when people can say, like, I have type 1 diabetes, but it's not going to control my life. I can still make my dreams come true, have the career I want to have the family I want to have. My friends aren't going to think less of me because of this. Then they're often able to start actually learning what it takes to take care of themselves and doing it from an empowered place. But there's often so much resistance if we're at a place where we feel shame about our diagnosis. And I see that with high cholesterol and high blood pressure and all of the other chronic diseases that typically come for people later in life. And so I think it's kind of the same throughout medicine. Is it almost doesn't matter the diagnosis, it's the idea that we have to have peace with it.
Yeah.
It's showing up for us. It is what it is, and then there are things that we can do that can make our life better, and we don't have to let it control us fully. We still have agency over our life. And I think once you make peace with that, then it gets
You
easier.
feel empowered. Yes, I
Yeah.
mean, and absolutely, like you're right, because a lot of times when patients are not able to make peace with it, then um, they don't feel like they can take charge of their decision making with it. And so they make irrational decisions that, end up in the hospital because they see, I've had patients who a chronic disease feels like a life sentence to them. And it's like, no, you can still live your life and enjoy it. You can't, I mean, it's just you have to have certain restrictions now. But, having this doesn't change who you are as a person. You're still the amazing person that you are. It's just now your health, perspective health wise has changed. So I'm sure, like I said, just having you as an ally for that helps your patients to like, okay, if she can take charge of this, and I also can do that. So thank you so much for sharing your story. Now, how does your work today allow you to care for patients in a way that feels, do you feel like you've gotten to that point where now everything's aligning with your values, kind of the 13-year-old that your 13-year-old self, looking at you now saying, she's doing what I wish someone had done for me then, and you feel like this sense of wholeness and fulfillment?
It's becoming more aligned. I think I'm certainly still on a journey kind of with my career. And I think my work in practice with seeing patients at the clinic is aligned. One of the other things that I have started doing is creating educational information on YouTube, similar to you, but specifically towards people with type 1 diabetes and other chronic diseases. And
Yeah.
some of it is more medical based about vitamin D and such, but others is more about that making peace with the diagnosis. And so I have some other pieces around that. But I really believe that my mission in healthcare is to be a part of the change to move us more towards having systems implemented for prevention for people so that those who want to learn how to take care of their bodies, have a place to go to learn it. And also really wanting to make space for a little bit more of the kind of mental, emotional support with diagnoses. Because those are kind of the two things that I think were the holes that were very clear to me growing up as a patient. And so I hope to do more work, whether it's in policy or education, or direct patient education or CME, in that direction of creating systems or working on systems that are being created in that direction, because I think that's the true change. I love helping patients one-on-one, but there's more to do, and I feel called to move in that direction.
That's awesome. Now, looking back, what did choosing your own path and, teach you about trusting yourself?
Oh, these questions are so good. I have to think about this one. See, I think maybe it came from a place of when I think back to being starting college. I was doing well with my blood sugar management. My endocrinologist said I was, one of the better patients in the practice. I had a stable A1C, but I still felt the impacts of diabetes on my life. I was still having high and low blood sugars more than I wanted to, and entering college, that was challenging. And then I got mononucleosis, the Epstein-Barr virus, and really struggled with my health. I had active antibodies for months and swollen lymph nodes for months, and it just took me a very long time to recover. And I kept going to the doctor and different specialists asking, how can I feel better? I'm in school, I need to
Yeah,
be going to my classes. And I just didn't get answers. All these great physicians, and they truly were wonderful and caring, but
yeah,
they're just, there weren't great answers out there for that situation, other than just like kind of keep trying harder, sleep more and keep trying to take care of your blood sugar as much as you can.
yeah,
And so that wasn't working. And so I think I lost a little bit of trust with the medical system. And at the time, I was more cynical about it. It kind of, I think I thought they're supposed to know how to help me and they can't. And that I feel alone and I feel overwhelmed because these amazing doctors who've done all this training can't help me.
yeah,
How am I going to figure it out?
yeah,
But then I learned going through medical school, of course, that every doctor, at least that I've met, really cares about their patients and has learned so much. And the medical system is not designed to help with some things, and it's designed to help with others. And that's okay. That's just the way it is. And so I think I was unfairly judging my old physicians, just assuming they had different training than they did and not really
yeah,
understanding that. And so now, I think I'm at a place where going through that maybe more cynical mindset until I learned, better in medical school, was that I now have learned that I had to take my health into my own hands, and really look at. So I would go on PubMed and read books and listen to podcasts and reach out to different people and ask
yeah,
questions about how they were figuring out. And I figured out how to take care of my own health through my own kind of question and answer
yeah,
and just not giving up. And so I think it was that, not giving up. And now I'm really healthy and I'm happy with my health and I really like where it is. But a lot of that came from my own doing, not from someone giving me the answer. And I
yeah,
actually think my health journey of learning to trust myself has then led into my, medical career of learning to trust myself of, okay, there've got to be more answers. There has to be a better way, right? We can help people learn prevention. There has to be a
yeah,
better way. We can teach lifestyle medicine in primary care clinics. Like, there just has to be, more
yeah.
to it. And so it's that kind of constant idea of improvement, which sometimes I think is maybe unhealthy, it's too much, but I think it's that step is we need those people looking for different ideas. So
Well, absolutely. Well, thank you so much for, like I said, being that voice for patients when it comes to, cheering them on, especially in the field of lifestyle medicine, because it's so needed. It really is. Like, we know the stats already with chronic disease management, obesity, and there's so much that can be done in a traditional setting. So much volume of, some patients get it. When you right off the bat, they get it. But there's some, it takes them time. It takes them a lot of hand holding. It takes them a lot of, education, and most of the time, one of the things that I struggle with when I did my medicine certification was, oh, wow, I have all this great knowledge. but where is the time to actually sit down and go through all this, with patience? Like, it's great, I know it, but then the outlet is somewhat restricted in how
Yeah.
the information comes out. So learning that, like I said, there are physicians like you who are pushing and just trying to find, you know, policy changes or things of that nature that would help patients be educated, be armed, have all that awareness about it is it's a great thing for medicine. Yeah, so thank you so much. Now, my last question for you is, so what will you tell if, someone listening to you right now, a physician who feels like, I know I'm on the wrong path, but I'm so afraid to make a change. I know the change that needs to be made, but I'm so afraid to do it. What will you tell them today?
I think that I think medicine in America is a great thing. I mean, we have all of these incredible systems and hospitals, and it's wonderful that there are so many healthcare workers out there trying to help people with their health. But it doesn't mean that there's only one right way to do it. And I think I had to make peace with understanding that my path might look different than many of my peers' paths. And that's okay. And I think that if you're at a place right now where you feel like you're in a job that doesn't feel aligned for you, ask yourself, I think I say ask yourself, is it because the work that you're doing is not aligned, or the work that you're doing is too much and you're neglecting your own health? Because I think when we're in a place where we're working so many hours, we're working so much, and with our other life responsibilities, we're not able to take care of ourselves. It's hard to pour from an empty cup.
Yeah,
And so if your cup is empty because of the structure of your job, maybe it's not the wrong job. Maybe it's that you're not able to
yeah,
take care of yourself first, because nothing feels right when we're not taking care of ourselves first. And then, if you can have your job in a way where you can take care of yourself and then check in to see if it's aligned with you or not, and it's not aligned, then I would say there are so many paths out there that you've probably never heard of in medicine that are possible, and many people
yeah,
have done that. I mean, consulting work, working for research or insurance companies or pharmaceutical companies, or these direct primary care clinics, or there's so many different options out there and so many different paths. And we all are taught that very classic, pre-med, medical
yeah,
school, residency, plus or minus fellowship, board certification, clinic or
yeah,
hospital, 60 plus hours a
yeah,
week. And even I've talked to many women, and I went through this myself, is even the idea of working part-time feels shameful
yeah,
for men or women who just want to take care of themselves or spend more time with their family, and it's that, I think we have this idea that part-time isn't even acceptable. How
yeah,
could a different path be acceptable? And so I think just really checking in with, what do you want for your life and why are you here? And
yeah,
the hours of work or the extra finances that maybe you do or don't need, just maybe that's not as important as the mission,
yeah,
that you're on. And so I think that that would be the advice, is take care of yourself first, then check in with your mission, and know that there are probably a lot more paths than you know of.
Well, thank you. That was awesome advice. I mean, you've shown us, right, like I said, just based on you living an example that there are many different paths, and it comes down to you being fulfilled with, your calling. I believe for most people that medicine is a calling, right? And everyone's calling is different when it comes to medicine. And you listen to what you felt was right for you in your calling, and you were brave enough to take the step. And so you are a shining example of what's possible when you listen to that inner voice and you just do what feels right for you. So thank you.
That's incredibly kind. Thank you.
So if someone wants to find you, like you said, you talked about YouTube and social media, where can they connect with you, contact with you, ask questions if they need to? How do they reach out to you?
Yeah, so if you want to contact me directly, I have a website. It's drhannahparr.com. And on there, I have a contact page so you can reach out if you have a direct question. My YouTube is Dr. Hannah Parr, and Instagram is Dr. Hannah Parr. So all of those are easy to find. And I have health education on there that's general and for chronic disease management. So
Okay, awesome. I would put all those links in the show notes,
thank
but
you.
it's been amazing talking to you, Dr. Parr. So, for those of you listening, if you've been inspired, make sure you like, subscribe, share this video with a friend to let them know, hey, there is everyone doesn't have to take the traditional route. There are journeys outside of medicine. Just to, do what feels right to you and your calling and your fulfillment because, you can't practice. We're not going to be here forever, right? You want to be able to look back at your time in medicine or career, family, and say, okay, I feel like I did everything that I could possibly do and not have to look back with regrets or wishing you had done something different with your life. So if you have a story to share and you want to hop on, we are so ready to hear your stories at Physicians Keepers. Send me a message, draremlo@gmail.com, and I'll put all those things in the show notes. And we've had an amazing time today listening to Dr. Parr. And join me next time. I'm sure we'll have another amazing guest that we can share the stories. And Dr. Parr has been an amazing physician's keeper. And we're glad that her story is, encouraging another physician. So thank you, Dr. Parr.
You're so welcome. Thank you for having me.
Thank you for listening to Physicians Keepers. I hope today's conversation gave you something useful to carry into your life or practice. If it resonated, share it with another physician who might need it. And if you have a story that could help someone else, I'd love to hear from you. Connect with me on social media or send me an email. See you in the next episode.